As if there wasn't already enough reason to fear the operating table. A new study has revealed that women with male surgeons are more likely to experience complications when going under surgery performed by male surgeons. The study, which was published in the JAMA Surgery Medical Journal, took into account the records of more than 1.3 million surgeries performed under 3,000 surgeons, and monitored the outcomes of 21 different types of common surgical procedures ranging from hip replacements to brain and heart operations. In the study, negative outcomes were defined as complications and readmission to the hospital 30 days after procedures, and of course, death. The numbers ended up showing that women were 32% more likely to die under the care of a male surgeon, and were also 16% more likely to experience complications, and 11% more likely to be readmitted to hospitals. Image. The healthy. Surprisingly, even male patients weren't spared this concerning detail. Men were 13% more likely to die under a male surgeon's knife compared to a female surgeon. We have demonstrated in our paper that we are failing some female patients, and that some are unnecessarily falling through the cracks with adverse, and sometimes fatal, consequences, said co-author of the study Dr. Angela Jareth from the University of Toronto. This has real-world medical consequences for female patients. Stick with your own kind? While Jareth could not explain the technical reasons for these numbers, especially because both male and female doctors receive the same type of training, she suggested that it could all be due to subconscious, deeply ingrained biases, stereotypes, and attitudes, as well as differences in the way male and female physicians work, communicate, and make decisions. While it all seems counterintuitive to the idea that all surgeons should be equally competent, other studies have also suggested that patients may actually benefit from sharing marginalized identities with their doctors, such as being the same gender or race. Image. The Washington Post. Giving an example of this, Jareth said that gender differences in communication styles and making decisions may eventually affect the entire outcome of a surgical procedure, such as how women patients may be more likely to follow post-operation procedures better if they received their advice from a female doctor instead of a male one. Another 2020 study even showed that African American newborn babies were 3 times more likely to die under the care of a white doctor, as compared to white newborns. The death rates, however, decreased when black doctors were placed in their stead. Again, these study results can hardly be taken as concrete proof that it's safer for females to get operated on by female surgeons compared to male ones, but the numbers do suggest that there may be more to look into regarding how medical professionals differ in their styles of work based on their genders. Read more life stories. 8 unusual superstitions you would have heard of if you're Asian. Michigan Health Minister hits back at people claiming he's still not vaccinated. The state of sex toy recycling. Cover image sourced from New Straits Times.